So, as I posted already, I uploaded the video. FDA approves IQOS. There are several restrictions on this particular IQOS because the Food and Drug Administration slash Center for Tobacco Products considers it, even though it's a heat not burn technology, the FDA pretty much considers the IQOS like a cigarette. And so it's going to be regulated exactly like a cigarette. Yes, even though there's no combustion involved. And therefore, there are a lot of restrictions that are a part of this particular approval. This approval has strings attached to it. So let's go through it. So here it is. The Food and Drug Administration's website comes out of the FDA newsroom, FDA news release. FDA permits the sale of IQOS tobacco heating system through pre-market tobacco product application pathway. And like it says here, they have restrictions on there, and it's April 30th, 2019. And that's pretty much authorized the marketing of new tobacco products manufactured by Philip Morris Products SA for the IQOS tobacco heating system. An electronic device that heats tobacco-filled sticks wrapped in paper to generate a nicotine-containing aerosol. The FDA has placed stringent marketing restrictions on the products in an effort to prevent youth access and exposure. And then they talk about the PMTA and all this other stuff. Like it says, today's action is not a decision on the separate modified risk tobacco product applications, the modified risk claims, that the company also submitted for these products to market them with claims of reduced exposure, reduced risk. And that's probably going to be denied, but it could be, but the chances of that happening is on the extreme low side. And like it says, the FDA is putting in place post-market requirements aimed at, among other things, monitoring market dynamics such as potential youth uptake. We'll be keeping a close watch on the marketplace, including how the company is marketing these products, and will take action as necessary to ensure the continued sale of these products in the U.S. remains appropriate and make certain that the company complies with the agency's marketing restrictions to prevent youth access and exposure. As other manufacturers seek to market new tobacco products, the FDA remains committed to upholding the vital public health standards under the law and using all the tools at our disposal to ensure the efficient, appropriate oversight of tobacco products. Now that they have this heat not burn technology approved by the FDA, all these other heat not burn technology devices, all they have to go through, for the most part anyway, like 80-90% of it anyway, is through the substantial equivalence. So it'll be a lot easier, it'll be a lot cheaper, less paperwork, and a lot quicker process for other companies to submit their heat not burn technology. Now, Philip Morris does have proprietary information in regards to the IQOS. Now, the PMTA that I even done on this channel, I did it. It took me, I don't know, 2-3 hours to do. And I think it was like 2 videos I did it in. It shows exactly what the technology is. It shows you exactly all the testings they had to go through and all that. And because that is public information, because I was able to obtain it off the FDA website, just had to download all the zip files and then open them up. Other tobacco companies like R.J. Reynolds, Benson and Hedges, Lord, British American Tobacco, whatever else have you, can certainly use that public information to assist themselves in how to do the testings and things of that nature. Of course, that's for PMTA. They do have draft guidances on the substantial equivalence. It's been around for years, and they'll just not do all these testings that they would have had to have done if they were going for a PMTA. They'll just go for an SE, a substantial equivalence. So in the next few years, you're going to probably see a lot of more heat not burn technology come from big tobacco. So again, with the standard requires the FDA to consider the risks and benefits to the population as a whole, including users and non-users of tobacco products. Here's a good one. So in particular, through the FDA's scientific evaluation of the company's applications, peer-reviewed published literature and other resources or other sources, the agency found that the aerosol produced by the IQOS tobacco heating system contains fewer toxic chemicals than cigarette smoke, and many of the toxins identified are present at lower levels than in cigarette smoke. For example, the carbon monoxide exposure from IQOS aerosol is comparable to environmental exposure, and levels of acrolein and formaldehyde are 89 to 95% and 66% to 91% lower than from combustible cigarettes, respectively. So they see that these particular cancer-causing agents or toxins or chemicals are much lower in the IQOS, and that's one of the reasons why they put it on the market. Additionally, IQOS delivers nicotine in levels close to combustible cigarettes, suggesting a likelihood that IQOS users may be able to completely transition away from combustible cigarettes and use IQOS exclusively. Available data, while limited, also indicate that few non-tobacco users would be likely to choose to start using IQOS, including youth. Now, like it says, it's limited data, but it shows that probably the youth are unfortunately too caught up with the jewels rather than IQOS. But this is a wait and see kind of situation here. So while these combusted cigarettes may be referred to as heat not burn or heated tobacco products, they meet the definition of a cigarette in the Federal Food Drug Cosmetic Act. Therefore, these products must adhere to existing restrictions for cigarettes under FDA regulations, as well as other federal laws that, among other things, prohibit television and radio advertising, in addition to further limit youth access to the products and exposure to their advertising and promotion. The FDA is placing stringent restrictions on how the products are marketed, particularly via websites and through social media platforms, by including requirements that advertising be targeted to adults. The company must also give notification to the FDA, among other things, its labeling, advertising, marketing plans, including information about specific adult target audiences, and how it plans to restrict youth access and limit youth exposure to the product's labeling, advertising, marketing, and promotion. The agency has issued a document providing its rationale for these post-market requirements, which highlight important considerations for reviewing the company's applications, as well as any potential future PMTAs for other products. And this is where this whole thing is going to come from as far as the substantial equivalence. The FDA also is requiring all package labels and advertisements for these products to include a warning about the addictiveness of nicotine, in addition to other warnings required for cigarettes, to prevent consumer misconceptions about the relative addiction risk of using IQOS compared to combustible cigarettes. And this is an interesting one right in here. The FDA may withdraw a marketing order if it, among other things, determines that the continued marketing of a product is no longer appropriate for the protection of the public health, such as if there is an uptake of the product by youth. So, if Philip Morris, however they market their product, fails to prevent youth uptake of their products, guess what? Boom, boom, and bam, bam. The product will literally have to be removed from the marketplace. I mean, there are some serious, it's not like, the FDA is giving them a free pass. I mean, if there's ever a vapor product like you and I know of ever got through some kind of closed system or so, we'll be under the same situation like this as well. Even Juul, for that matter. That's why it's going to be very difficult for Juul to maybe get a tobacco product, as a tobacco product, have the Juul tobacco, I should say tobacco classification, to have a Juul approved. Now, have a Juul approved via the drug application process, that's a whole different ballgame. But it'll be very difficult for them to do, because the whole crisis, the whole issue that the FDA takes with Juul is the whole youth situation. They would have to completely change their ways. I mean, it would take them 5-10 years to finally be able to prove to the FDA that their product, is not for the youth or whatever. It's just incredible. It'll be very difficult for Juul to get even though they have the money to do it. The best reasonable pathway for Juul would be a drug application, and they have money for drug applications as well. So for the new drug application. So it says the FDA is continuing its substantive scientific review of the company's that's modified risk tobacco product claims applications. The company would need to receive an MRTP order from the FDA before they could market a tobacco product with any implicit or explicit claims that, among other things, the product reduces exposure to certain chemicals, or that use of the product is less harmful than another tobacco product, or would reduce the risk of disease. If a company markets a tobacco product as an MRTP without authorization, the company would be in violation of the law and may face FDA advisory or enforcement actions. So it can either be civilly penalized or even criminally prosecuted. And this guy's still around, apparently. He's always with the media. So that's that. So yeah, I mean, IQOS is approved by the FDA, but it has a lot of strings attached to it. But I'm sure that Philip Morris / Altria does not mind to have those strings attached. They figure probably as we phase out the combustible cigarettes over time, we'll phase in the IQOS for Americans and the United States and its territories in regards to Americans. So this is more like their time frame is probably, they're thinking in terms of 5-10 years from now, because big tobacco always, and I've said this many a time in the past, that in all my videos, that big tobacco, even big pharma is the same way, but especially big tobacco, they don't think in terms of like 1 or 2 years. No, they don't even think in terms of 2 or 3 years or 4 years. They think in terms of decades. They think in terms of like the most minimum time frame that they think of is 5 years. But they plan out in terms of what happens in 10, 20, maybe even 30 years, but definitely 10 to 20 years is how they plan how they look at things, okay, in regards to selling their products. So within 10 years, they'll eventually phase out a lot of the combustible cigarettes. I mean, they're doing it already, but it's going to almost come to, like, it'll be extremely scarce to find combustible cigarettes. And if you do, they're going to be costing so much per pack that you'll have almost no choice but to go to their IQOS. And they'll have very clever IQOS advertising so they can make sure that they don't violate any of the conditions that the FDA put on Philip Morris, and target their advertising to adults. And so as they phase that combustible cigarettes out, they will phase in this IQOS. So by the time it's 10 years or 20 years from now, majority of the smokers will have the IQOS. Vaping, as you and I know it, will have long been gone. It would have been gone, a long time ago. I'm talking 10, 20-year plan here, okay? I'm not talking like 2 years. I'm talking 10, 20 years. And then, of course, the big pharma will always be there. And then maybe they'll come out with some kind of novel electronic nicotine delivery system, and they'll have either be prescribed to you or over the counter, or maybe both. Who knows? Well, here you are. It took them a while. According to the federal statute, the Family Smoking Prevention Tobacco Control Act of 2009, the FDA has up to 180 days or 6 months to approve of a submission in regards to PMTAs, or even substantial equivalence, or even exemption of substantial equivalence. They're allowed 1 month grace period when they notify the manufacturer that, well, we haven't made a decision yet. Then they're allowed about a 30 day to 45 days tops grace period outside of that 6 months. And the manufacturer can actually go through the Administrative Procedures Act, they can actually go to a court to push the FDA to, make a move, make a decision, I should say, make a decision to either deny it or approve it. Normally, manufacturers don't do that because if they get under the skin of the FDA, they piss them off anyway, they'll just deny it all up and down. Of course, if they deny it, you can do a reconsideration of the submission. If they reject it again, then you apply the Administrative Procedures Act and you go to court over that. And then it can go up on appeal, and then it stops. The United States Supreme Court does not hear these types of situations. So it goes to United States Court, and then it goes to the Court of Appeals, and then and every case I've read in regards to these types of approvals, which aren't many. I mean, I think the only approval it's been is a Swedish Match, and this one here with Philip Morris in regards to tobacco products, that is. But there have never been any like Swedish Match. They got an approval. So, but they were never denied. So there aren't really anything on the books. But like FDA warning letters is a perfect sign to know what I'm about to say, and that is these FDA warning letters that go out to, could be vaping or even tobacco companies. They get them too, of course. Tobacco manufacturers, whoever gets them, convenience stores that sell combustible cigarettes or whatever. Every time that the FDA goes to a court of law over one of those FDA warning letters, they win all the time. So let's say it was denied, the application, the submission for the PMTAs were denied. When it goes to a court of law, when it goes up on appeal, the FDA is going to probably win. The chances of you winning, especially on appeal, after you lost in the lower court, is probably about 2%. It's not even worth the money. By the time you do all that, you'll be out of business anyway, because not only can you can't market the product while it's in the court system, you're losing money every day to lawyers, and then it's really a losing battle. But anyway, so I just want to explain a little bit of the process. I've talked about that before, but I thought I will add that to this video as well. As far as vapor products that you and I use, I don't see it ever happening. But even being submitted, it might be submitted, but like maybe 5 pawns or something like that. But yeah, I mean, they have 6 months, but this has been over 2 years since they've been reviewing this particular submission for the PMTAs on IQOS. And it was just about as long with the sweetest match. So, but once, and the irony of it is, once you submit it, if the product is on the market already, and you submit your submission in regards to the PMTAs, you're allowed up to a year. Knowing the FDA, they may extend that for you, even because they're going to take longer than a year to review the submission, unless they, well, they have to be careful. They just can't they can't just deny the submission just in a casual manner. They have to have reasons to do so, because if it goes into a court of law, and if there's any capricious or it's arbitrary to the law or an abuse of discretion or any of that, the FDA can very well lose in a court of law. So when they make those approval denial decisions, they have to stick. They have to be correct, because they could possibly lose up, in the court system. Anyway, I just want to share this with you. And I don't do much IQOS videos, but this was somewhat important because of, I think everyone knows about the IQOS, even as a vapor. I never used the product. I had a friend that his friend is, I can't remember where his friend was from. I think the UK or something like that. And I remember holding it, the product in my hand, and it was kind of weird. It's like a little tiny case, and then it had these little tiny. They say it's the tobacco is wrapped in paper. I thought it felt like it was wrapped like almost a plastic kind of stick in a way. I never vaped on it or smoked it or whatever you want to call it. I don't know how Philip Morris is going to do it, as far as get the word out. Do you vape this product or do you smoke this product, right? So I guess they're going to have their own buzzwords for all that. But I did hold the case, and it felt like a little I don't know, it felt like a plastic, I don't know, just like a little plastic case. It was like kind of weird. But anyway, that's as close as I got to IQOS. I'm not going to be buying one of them. But still, the smokers out there that, cigar smokers or combustible cigarette smokers will certainly have that as an option. And I'm sure Philip Morris, as I'm speaking right now, are cranking these things out left and right now off the conveyor belts. Probably cranking them out, probably, who knows how many. Probably 5,000 of them a day. Maybe more, who knows. Anyway, I'll let you guys go. Just thought I'd share this with you. Guys, have a good one. Bye-bye.